Nail fungal infection. Nail fungal infections are the most common diseases of the nails, making up about 50% of nail abnormalities. Fungus is normally present on the body, but if it overgrows, it can become a problem. They are also known as onychomycosis and tinea unguium. Causes. Microscopic organisms called fungi cause nail fungal infections. They do not require sunlight to survive, so can thrive in these areas. Most commonly, a group of fungi called dermatophytes, such as Candida, is responsible for nail fungal infections. However, some yeasts and molds also cause these infections. These include Trichophyton rubrum, the most common dermatophyte that causes nail fungal infections. Common mold causes include Neocytolydium scopulariopsis aspergillus. Pathogens that cause nail fungus infection usually enter the skin through tiny cuts or small separations between the nail and nail bed. The fungi grow when the nail provides a suitably warm and moist environment. Symptoms. Nails that are infected with fungus typically are thickened, brittle, crumbly, ragged, distorted, dull, darker or yellowish in color. There may also be scaling under the nail, hyperkeratosis, yellow or white streaking, lateral onychomycosis, yellow spots at the bottom of the nail, proximal onychomycosis. Infected nails may separate from the nail bed. Onycholysis. Nail fungal infections can result in pain in the toes or fingertips, and they may even emit a foul odor. Diagnosis. In order to diagnose nail fungus infections, a doctor will usually examine debris that is scraped from underneath the nail. The nail scrapings will be used in tests, such as a potassium hydroxide, KOH, smear, or a fungal culture. The KO test can be quickly performed, while the fungal culture can take weeks. Physicians must be careful when diagnosing fungal infections of the nail because several other conditions can result in similar symptoms. These include psoriasis, lichen planus, contact dermatitis, trauma, nail bed tumor, eczema, and yellow nail syndrome. Treatment. Treating nail fungus infections can be a long and expensive process. There are oral antifungal medications, topical ointments, and alternative therapies. Over-the-counter creams and ointments are available, but they have not proved very effective. Oral medications for nail fungus infection include terbinafine, Lamisil, itraconazole, Sparinox, fluconazole, diflucan. These typically take up to 4 months before fully replacing the infected nail with uninfected nail. In some extreme cases, a physician will opt to remove the entire nail. Prevention. Preventing nail fungus infections requires hand and foot hygiene. Some suggestions include keeping nails short, dry, and clean, wearing socks that breathe, usually synthetic, using antifungal sprays or powders, wearing rubber gloves to avoid overexposure to water, refraining from picking or biting nails, using artificial nails and nail polish less often, washing hands after touching infected nails,